Welcome, everyone. We'll get going in just about 1 minute. We have some more people joining us every few seconds here. All right, good morning, everyone. Thank you for joining us here at the crack of 8 o'clock on a Thursday morning. I'm Joe Hannell, Communications Director at the Colorado Health Institute. On behalf of everybody at CHI, thanks for getting in touch with us on this monthly basis in our new Eggheads webinar series. We had a lot of folks, 90 or so, attend last month's installment, and we have even more signed up today. I expect people will be trickling in as the morning continues. We are really looking forward to the day where we can maybe do this in person. And thanks to everyone, thanks to all of you and everyone else in public health and in leadership and just in doing their own little part. It looks like we are going to be able to do that very soon, because we can now start to see the end of this pandemic, and we're just so gratified about that. And we are hoping that that one day in the not too distant future, we'll be able to all join together at CHI's offices in addition to this virtual method, and get together and see each other face to face again. And breakfast is definitely on us. So just to kind of shake off the cobwebs this morning, I want to take a quick little poll or drop something into the chat. When we have our first in-person Eggheads, what do you want for breakfast? We'll make it happen. So drop in the chat what we should have. Nothing. All right. No breakfast for you folks. All right. Well, couple little housekeeping items before we get going. This webinar is best viewed if you go up onto the top right of your Zoom screen and hit speaker view. We have some graphics that will be next to our speakers, and much easier to read when they're big on the screen rather than in a little grid. And then we encourage participation and a little bit of virtual crosstalk and questions and answers. So best thing to do for Q&A is to use that Q&A button at the bottom of your screen. Type in a question, and after Allie and I get going, after Allie and I get through our presentation, we will have plenty of time to engage those questions. So just drop them in there throughout as they occur to you, and we will get to them. So with that, I would like to introduce Allie Morgan. She is our director of the legislative program here at CHI. Allie and I both joined CHI within a few months of each other 7 years ago. So we've been covering the legislative session together ever since. And I will turn it over to Allie to continue with the presentation and let her introduce herself further.
All right, thanks so much, Joe, and good morning, everyone. It is great to see, or I guess at least know, since I can't see you, that there are so many of you out there with us this morning. Thanks again for joining for the June installment of our new Egghead series. This is, as Joe mentioned, a chance for us to share our new research and analysis and thinking with you, and also hopefully learn from you. So that's why we'll definitely try to leave 15 minutes or so at the end for Q&A and discussion. So today, of course, we are talking about Colorado's 2021 legislative session, which wrapped up just last Tuesday, June 8th. As many of you know, when the session would end this year was a bit of a moving target. And so we're really glad that the timing worked out and we had a little bit of time to prepare for this. We look forward to sharing some initial thoughts and takeaways with you today, though we're certainly still processing the end of the session. As Joe mentioned, my name is Allie Morgan. I'm the Director of Legislative Services here, been at CHI doing legislative work since 2014. I also manage our internal research agenda and calendar and support on a variety of consulting work. And I'll let Joe give a little bit more about his background later when I hand it over to him. Also want to acknowledge that we have some other colleagues on the webinar today from CHI's legislative team. And so they may be available to answer questions or share links to relevant legislation, bill numbers, that kind of thing in the chat. But big thanks and kudos to Eli Boone and Julia Char-Gilbert for their exceptional work. We could not have done it this year without them, and they're a great team. So we're really grateful to have them as well. Legislative monitoring and education is something that is really near and dear to our hearts at CHI. It's a big reason why we were founded almost 20 years ago. Each session, we meet with legislative staff, policy and advocacy and industry groups, and legislators and other elected officials from across the political spectrum to provide analysis and data that hopefully support effective policymaking. And as always, we don't take positions on bills. We enjoy discussion opportunities like this one to share things in the most objective manner that we can. So please use the Q&A button down at the bottom of your, it's probably about here on your screen, the bottom of your window to share questions that occur to you throughout. You also have the chat bar available to you on the right side if you have comments or technical questions, things Eli might be able to jump in and help with, for example. And just a final note, again, we're recording this session and we'll post the video to our website before the weekend. So let's get into it. We're going to share 3 takeaways with you today in true CHI fashion that we hope you remember from this webinar. First is that Washington is back in the health policy business. And so after a decade, we knew going into the beginning of Colorado's legislative session that the federal government was going to be involved in health policy in a really significant way for the first time truly since the very beginning of the Obama administration. So it's been quite some time since the president and Congress have really been proposing much in the way of new health policy programs and initiatives. And that's important because it creates new dynamics for our state legislators to have to consider while they are engaging in policymaking here. Second is that Colorado legislators did a lot with a lot this session. Just a year after having to make some incredibly difficult budget cuts, legislators found themselves in the opposite position, an unusual position of having a really large surplus, mostly because of the American Rescue Plan dollars, but also thanks to some state stimulus funding. It is a heavy responsibility to make sure that kind of opportunity doesn't get wasted. And indeed, I think we saw some really sizable investments in meaningful ideas this year, although many of those funds have not yet been allocated. And finally, we have this new generation of legislators at the Capitol who are really thinking big. Among this younger and more diverse group in many ways, there was a clear focus this year on advancing equity and on tackling big policy discussions, including those that had begun back before the pandemic and had kind of been sidelined temporarily. So it was not an inconsequential year for policy despite the pandemic. With that background, I want to briefly recap what's been going on in Washington, because again, it affects a lot of the work that your state legislators did this year. Over the past 5 months or so, Colorado lawmakers had to be simultaneously moving their own ideas forward while also keeping an eye on what was happening at the national level. And that can just be a little bit complicated, especially if there are policies that might overlap in some way with things we're talking about at the state level. Biden care might not have the same ring to it as Obamacare, but it's clear that the president has some big health policy priorities. And so we wanted to touch on those quickly, since this is our first real legislative webinar with all of you since he took office. Here's a quick status check on a few of Biden's top priorities and where those stand. So first was passing a federal stimulus plan. That's done. Biden signed the American Rescue Plan Act, or ARPA, as we have been referring to it, into law on March 11th. Second is vaccine distribution. Of course, this was an urgent need. It still is, and it was feeling particularly urgent in January. When I last checked yesterday, I think there were 312 million doses that had been administered, so about 45% of the population fully vaccinated across the country. However, we of course did just pass the staggering threshold of 600,000 deaths as a country from COVID, and so clearly we are very far from being out of the pandemic. And honestly, it can be hard to think past the pandemic still, and who knows how much appetite and political will there will be for tackling other big policy questions, health policy questions, once we do emerge a bit more from the pandemic. But I think we're starting to see some signs of that. Third is about building on the ACA. In some ways, all the health policy goals that President Biden talks about come back to the Affordable Care Act, and realizing kind of the unfinished business of this law 11 years after it was passed. I had in my notes that we were still waiting on the newest Supreme Court ruling and that there's been some uncertainty, but I saw in the chat from our friend Markian that apparently that came out this morning, and that the decision said that the plaintiffs lack standing. And so I believe that that's our answer there, and that I think fits with what the indications were from oral arguments back in November, that the law was unlikely to be struck down despite the 6-3 conservative majority. So ask Markian if you have immediate questions about that. I don't have any more information because I think it just happened, but we'll be interested to see now what that means for ACA efforts going forward. Prescription drug pricing is something that's clearly been top of mind for Colorado legislators for years. President Biden also is interested in this, things like allowing Medicare to negotiate drug prices and capping prices potentially based on how expensive they are in other countries. And there have been similar efforts, considered and talked about and passed here in Colorado. And then one other thing that's been on the minds of Coloradans lately is the public option. Congressional Democrats have a couple of different public option proposals on the table, including one known as Medicare X from Colorado's own Senator Michael Bennet. Unclear at this point if this idea can or will gain traction at a federal level, either on its own or through some vehicle like reconciliation. So in the meantime, states like ours are forging ahead with their own plans and moving forward with a public option in different ways. I want to go back now to talk about the stimulus plan a little bit more because it was such a big deal, not only in DC, but here in Colorado, and kind of as a part of our legislative session as well before we really get into it. So state legislators here knew for much of the session that a significant amount of federal aid was coming. They just didn't know exactly how much or quite when it would be here or what the guidance would be in terms of the rules for spending it. And we finally got a little more clarity toward the end of the session that allowed some decisions to be made. So the COVID-19 relief bill, ARPA, again, American Rescue Plan Act, was projected to infuse a ton of money into Colorado. I'm curious if anybody remembers or saw the total amount that was estimated by the JBC or Ledge Council staff for the impact in Colorado. If you remember, if you could throw that in the chat, it's a pretty large number. It includes direct aid to residents from stimulus checks and unemployment, in addition to all the money going to the state, counties, cities. I see 3 billion. I'm actually looking for a much larger number than that. All right. The true number is actually $27 billion. And maybe my question was a little misleading, but if you look in the memo, the full impact of the stimulus in Colorado, including things like unemployment and stimulus checks for residents was $27 billion. So it's an enormous amount of money. That includes $1.9 billion available for Colorado counties and municipalities. And then of course of special interest to our state legislators, another $3.8 billion for the state to spend. Much of that has been parked recently in this new state account to be spent and decided, and Joe's going to detail that shortly. And thanks to those of you who are playing, I can tell you follow this because you're talking about other numbers we've been following that are more specific to the state level. Relief funds can be used for 4 different purposes per guidance from the Treasury. I'm not going to spend much time on this, but just so we're all on the same page. The first is responding to the public health emergency and the economic recession. This is most similar to the CARES Act funds that came in the previous round of federal stimulus or federal relief money. Second is supporting essential workers. Third is restoring government services that were reduced due to the pandemic. And this is actually the one that state legislators have kind of zeroed in on because they think there might be the most flexibility here for them to use to spend these funds. And then a narrower focus on investing in infrastructure for water, sewer, and broadband. These funds can be allocated for expenses between March 3rd of this year and December 31st of 2024. However, we did get some clarification a few weeks ago that they can be used for expenses that occur through 2026, as long as the money's allocated and those decisions are made, I believe, by the end of 2024. And so getting that clarification reduced the sense of spending urgency just a little bit in the final weeks of the session when legislators were figuring out how much of this do we need to get out the door now? Are we going to come back for a special session? Can we wait until next year? And I think that, again, this just gave them a little more time. Finally here, I'll just briefly mention that we also had a huge amount of state stimulus money, right? $800 million. That funded a variety of programs, and some have stated that having our state legislators know that that was available to them right from the get-go this year allowed them to kind of get a jump on restoring some cuts and funding some programs while we waited for more information at the federal level. So I think many of them felt that that was helpful to have, and Joe will talk more about that too. Okay, I want to turn to focusing on the 2021 session itself now. This was clearly unlike any session we have ever followed at CHI. We're learning more every day as the dust settles, and we will have a more complete picture soon. We knew that the session would likely feature really clear cause and effect, showing how major recent events resulted in pretty immediate policy changes. Of course, legislators did a lot to respond to COVID-19, from broadband bills and telemedicine policies to support for rural areas and student mental health. We saw lots of bills in direct response to the pandemic. So that's kind of being referenced by this upper left image here. The Black Lives Matter protests that really came to a head in 2020 and continued calls for justice over the 2019 death of Elijah McClain resulted in some additional criminal justice and policing reform measures this year, including a bill that includes some new restrictions on the use of ketamine. The severe wildfires last year in anticipation of more severe drought this year, which I think we've all been feeling this week with the 100-degree temperatures, resulted in consideration of more wildfire and water management bills, and also continued discussions about climate change this session. And then finally, the mass shooting in Boulder in March gave sort of a new push to a set of firearms bills. These have always been controversial in Colorado and previously have resulted in some legislator recalls. But despite that background, a handful of those did pass this year. So Joe and I have identified 4 overarching themes of the session. I'm going to preview them here, go through the first one, and then I'll hand it over to Joe. The first one here is that representation matters. And by that, we mean that this is a much different Colorado legislature than we saw just a few years ago. The members are more diverse, many of them are younger, and many of them are bolder in their policy stances. That's true on both the left and the right sides of the aisle, or of the political spectrum, excuse me. And that just impacts policymaking and what's considered. Second is that it was a landmark year for health equity. The legislature gave the green light to major expansions in things like prenatal and postnatal coverage, contraception access, immigrant rights, housing supports, and more. From shortfall to surplus. Last year, we thought we were facing the biggest economic crisis since the Great Depression. It was indeed very difficult. But as a state, we've just bounced back faster than anyone expected. And so legislators had a chance to really help people this year, and even to fix some things that have been on the wrong track for a long time with the money that they had available. And finally, big health policy and other policy plans turned out to be immune to being sidelined by COVID-19 this year. Going into the session, some legislators and policy watchers said this was not a year where Colorado could afford, sweeping policy changes, especially if they weren't directly related to the pandemic. But a lot of big things ended up happening in the health space and in other areas like transportation. From a not so public option to prescription drug price controls and oversight to the creation of some new state offices and departments. If other themes jumped out to you this year, we'd love to hear them. So feel free to share in the chat overarching takeaways that you think might represent the session. So again, I'm just going to walk through this first theme with you before handing it over. And this again is about representation mattering. I want to start with a look at the Black Caucus in Colorado. So just a decade ago, there were exactly 2 Black members of the legislature. They did happen to be the Senate President and Speaker of the House. This is a photo of most members of this year's Black Caucus. I think the caucus has 9 members officially, 3 in the Senate and 6 in the House. And it's not just the fact that Black Coloradans are represented, it's the boldness of that representation in our state legislature. A lot was accomplished that originated or otherwise was pushed by this group. We saw successful bills focused on environmental justice, creating an equity strategic plan, criminal justice reform, reducing inequities in maternal and child outcomes, just to name a few. Notably, there was a bill to reform school discipline practices that failed. But again, many of these ideas really came from members of this caucus, and I think they were particularly visible this year. I also want to look at Colorado's Latino Legislative Caucus, which is even larger with more than a dozen members, including notably the Senate President. Latinx legislators also pushed many successful policies this year, from immigration legal defense and housing protections to broader access to multilingual ballots. At times, they've spoken out in partnership with members of the Black Caucus on issues of discrimination and calls to action. And so again, I think that that's notable that we're seeing that front and center in the legislature. Next is young women and young mothers in particular. In addition to sending a message to young women that they can and should have voices in the state legislature, we've seen more support for policies that are directly in their interest. For example, Senate Bill 27 this year provides $2 million to the State Human Services Department to offer diapering essentials to eligible Coloradans that could cover 26 million diapers. So this is not an insignificant amount. Another Senate bill, for example, guarantees free menstrual products for students. And with the House Majority Leader currently pregnant, I just don't expect this group's influence and visibility to decrease next year. And then finally, just a few thoughts on some internal political dynamics and divisions on both sides of the aisle. With many members of the Democratic caucus being more progressive, a small group of moderate Democrats in the Senate, like Rhonda Fields, Joanne Janal, and Rachel Zenzinger, who are pictured here, had quite a bit of influence. And the party split, as most of you know, is really close in the Senate. So even though Democrats control both chambers and the governor's office, it turns out that is not always enough for a Democrat-backed bill to pass, or at least to pass intact in its original form. So we saw that changes, not too infrequently, had to be made proactively to bills in order to guarantee that they could get through the Senate, even if they had, fully Democratic or bipartisan sponsors, which to me just reiterates that the Democratic Party and all political parties are not a monolith, right? And so it's important to understand the different dynamics within them. And that is certainly true on the Republican side as well. We saw some disagreements and division between Republicans laid bare this year, particularly in the House. Representative Hugh McKean, who's pictured to the left, represented a shift when he took over the House Minority Leader position from Representative Patrick Neville. Neville, who's still in the House, is definitely on the further right side of the Republican caucus in the House, while Representative McKean is more of a moderate. And there were disagreements at times over when and how that party should use their influence to impact political discussions this year. And in recent days, after the conclusion of the session, some Republicans have said publicly that they weren't as successful as they would have liked to be in sort of blocking Democrats' agenda. So I think the takeaway for me there is that there's a question of where do Colorado's Republicans go from here? How do they want to show up, and how do they want to influence the state's increasingly blue policy agenda next year and beyond? So with that, I'm going to hand it off to Joe to take us the rest of the way.
Thank you so much, Allie. It just certainly is a different legislature today than what I've been used to. I've been following the legislature professionally since the late 1990s as a newspaper editor, then a reporter, and now here at CHI. And a lot of the bills Allie just discussed and I'm about to talk about never would have come close to passing 10 years ago or even 5, even with Democratic majorities. So I think it's a testament to how Colorado is changing and becoming more inclusive, and the legislature along with it. We really see that in terms of the equity legislation that passed this year. Health equity and equity in a broader sense. So on this theme, let's take a look at, start with a look at reproductive health. 2 bills I want to spotlight are combining to add a $9 million investment in this space. The first is bipartisan. It extends Medicaid benefits to a larger group by raising the income threshold that qualifies for maternity and postpartum care. Pays for things like contraception, counseling, infertility assessments, sterilization, sexually transmitted infection treatments. And then there's another bill that adds an additional $4 million to the 5 from the previous bill. And this is for reproductive health care for immigrants without documentation through Medicaid. It's projected that this will help avoid 200 unintended pregnancies every year, which has labor and delivery costs to the state budget of an average of $10,000 each. So it's in the longer run could be a cost-saving measure, as well as providing coverage for families when they really need it the most. Next, legislators they've required better insurance benefits for contraception and STIs. This includes no cost sharing for contraception or for counseling and prevention of STIs, and it requires doctors to treat minors for sexually transmitted infections and to provide prevention without getting their parents' approval first. Another big kind of cultural shift here in the legislature. I want to spotlight a couple of bills that add protections for pregnant women. Senate Bill 193 covers a lot of ground in medical malpractice, insurance coverage, clinical practice, but it also adds rights for women who are in correctional facilities and sets the minimum standards of care that they have to be provided. And then the next bill up, Senate Bill 194, it expands Medicaid coverage for mothers to a year after the baby is born. And this will allow mental health treatment in that really crucial postpartum year. Next, Colorado's problems with housing affordability they got some real attention this year. One bill from the House overturns a 2-decade-old court case that prevented cities from requiring developers to rent some of their units at below market rates. Then there's another bill as a restriction on late fees on rent and forbids evictions merely for unpaid late fees. And then finally, there's a bill allowing the state to make grants to convert unused hotels into housing for people experiencing homelessness. And it adds a $15 million kickstart to that fund from the state. As Ali mentioned, there's a lot going on in police reform and also prison reform. House Bill 1251 is the kind of the highlight bill here. It restricts the use of ketamine by paramedics and allows it only for use in a medical emergency, not to help police restrain someone. This, of course, comes from the case of Elijah McClain. Next, another real landmark bill, I think, is Senate Bill 271, which is a wide-ranging rewrite of the misdemeanor law. This is a bipartisan bill. It's been in the works for a long time. It's the result of a comprehensive review by the Commission on Criminal and Juvenile Justice. And they reviewed 1,000 different misdemeanor crimes. And bottom line is it brings the sentencing range in line with most other states. Colorado had been on the high side of the national average for sentencing in these less serious crimes. Now, let's shift themes and talk about money. It's the big picture here is there is a lot of money coming Colorado's way. We're going to look at the part that's coming to the state government through the American Rescue Plan Act, or ARPA. So financial talk can get dull. So here's a picture of a duck. If you know why I dropped this picture of the duck when we're talking about the state budget, let us know in the chat here. Why did I put in a picture of this long-billed duck to talk about the state budget? It's because the state budget is called the long bill. It's just too early in the morning for this kind of humor. I'm sorry, I deeply apologize. The long bill last year was really, in 2020, was really almost a disaster. There was a $3.2 billion shortfall predicted for the state budget in May 2020. But by March 2021, just a couple months ago, that had turned into a $2.9 billion surplus. So what happened? Well, it turns out the legislature had cut a lot more than it needed to last year. So for the state budget, the 2020 recession was very deep, but also very quick. And that left, after all the other budgeting machinations were completed, that left $800 million for one-time stimulus spending by the legislature. And as I said, I've been following the legislature for a long, long time. I've never heard of state-based stimulus funding. The legislature always has tried to do more with less and often ends up doing less with less. This year and next, and maybe for a couple of years, looks like they'll be able to do more with more. So here are a few health-related uses of that $800 million stimulus from the state. This is not the federal stimulus. This is just what was left over from last year. First, as I'd mentioned, that $15 million infusion into a state housing fund that can support turning unused hotels into housing for people who need it. There's another $13 million to the Department of Local Affairs to provide affordable housing loans, but that is just the beginning because there's a lot more federal money on the way. One that could be really key in addressing youth mental health effects of the pandemic and the lockdown is House Bill 1258. It provides a free screening and up to 3 behavioral health visits for any Coloradan age 18 and under. And we've got a pretty big investment to start the 988 Suicide Prevention Lifeline Network. This actually is started at the federal government. Former Senator Cory Gardner sponsored the bill that got this set up nationally. And then there's $21 million in an infusion for public health, roughly half to the state and half to county public health departments. Those were just some of the items in the state stimulus, but there's also federal stimulus money on the way. That's almost 5 times what the state had to offer. And legislators have until 2024 to make a plan for how to spend it. They took the first steps this month. Now, this is a very general plan that, as far as we can discern, is how the money is going to be parceled out. Most of this federal stimulus is going into what we're calling a holding fund, $3.5 billion. And then it'll make its way to other funds. But even before that, $380 billion comes off the top to fund a big new transportation bill. So from that $3.5 billion, we have legislators put almost $850 million into economic development, $550 million into mental health, another $550 million into housing. So, but most of this money is not going to be spent until at least next year. This is just going basically from one savings account to another. The legislature did appropriate $100 million each in mental health and housing to be spent starting now. So, moving from the savings account to the checking account, basically. But decisions on the rest of it are going to be saved until the 2022 session. There are going to be 3 legislative task forces that are going to make decisions on how to spend it before the session begins in January. So that is, it's going to be a public process, and it's a great opportunity for all of us in Colorado to engage in how the stimulus actually happens. And then there are a few more pots of money that are even more wide open. This is $1 billion is what the legislature left itself to spend with really very few restrictions. This is the state's calculation of the tax revenues that it lost during the pandemic. And this, under the federal rules, is what the legislature has really broad discretion to spend. And the Governor Polis, will probably get $300 million on his own to send to state agencies of his choice. Bottom line here is that most of these funds are not going to be out on the street this year, but that we will all be able to engage in the process to at least share our opinions on how they should be spent. Keeping in mind that this is one-time money, that Congress isn't going to come back next year and throw another $3.8 billion our way, that this is not really to stand up a new program, it's to provide some money that can be spent in the next couple of years and then be done with it. All right, let's move on to the last theme we've identified from the 2021 session, and then we will start getting to questions. The big bills made it through for the most part. Let's start with, oops, my apologies. Let's start with the public option. As I scroll back through my presentation, which I just punted out of for some reason. All right, the public option. It's better stated as the Colorado option, and it's trying to get at high healthcare prices in a roundabout way through insurance prices. The state regulates insurance prices, but it doesn't regulate hospital prices for patients with private insurance. So the bill tells the Division of Insurance to design a standard health insurance plan that carriers would have to offer on the individual market and the small group market. And prices would have to fall by 15% by the year 2025 compared to this year. But the bill was amended a lot. It became really a lot less ambitious. The price reduction targets were modified. Originally, it was going to be its own nonprofit health plan chartered by the state government. But notable to us, the bill as it was signed yesterday, I believe, it allows prices to rise at the rate of medical inflation, which is usually a lot more than overall inflation. And the difference between medical inflation and regular inflation is why we have such a hue and cry about healthcare prices in our country. Next, transportation. Transportation plays a big role in health because if you know anything about social determinants, people need to be able to get around to see a doctor, to work, to do all the things that are associated with leading a healthy life. Senate Bill 260 makes pretty much a historic investment in transportation funding in Colorado. It starts with that $380 million from ARPA, and then it adds a bunch of new fees that will go to fund highways and mass transit and multimodal transportation. It adds fees for electric car registrations, for delivery services, Uber and Lyft, rental cars, and it creates a road usage fee on gasoline, which starts at 2 cents a gallon now, goes up to 8 cents. They don't call it a tax because under the Taxpayers' Bill of Rights, you cannot raise taxes without a vote of the people, but you can raise fees. Now, over the years, Colorado courts have interpreted fees in a way that is really lets the legislature have maximum power that they can to impose fees here. So I'm no lawyer, but if there were to be a legal challenge to this, I'd be shocked if it would survive the state Supreme Court. Next is drug prices. The big bill here was the Prescription Drug Affordability Board. This bill passed. Division of Insurance, I see, is already soliciting members to serve on the board that is going to set maximum prices on drugs. This was very hard fought against by the pharmaceuticals industry. There's another bill to expand the Canadian prescription importation program. Canadian suppliers have not been that willing to sell drugs here to Colorado since the original bill was passed a couple of years ago. So this expands it to other countries if they'd be willing. And then there are a couple of bills that attempt to get better deals from pharmacy benefit managers, which negotiate prices on behalf of insurers. So a lot more action on prescription drugs, which is this international market, than here, a lot more action here from Colorado than we had seen or really thought possible in the past. Now we have a couple new state agencies that are being stood up. This is a lot of effort, but despite the pandemic, here they come. First of all, there's a Behavioral Health Administration that has been now signed into law. It starts as a responsibility of the Department of Human Services, and it's going to centralize the behavioral health functions that are now spread among many different state agencies. This was a recommendation of the governor's Behavioral Health Task Force. And then there will be another new state department, the Department of Early Childhood. One of its tasks is going to be to implement universal preschool, which voters approved in a ballot initiative last year. So that's a whole lot of work, enough for 2 or 3 sessions probably. We're going to cover it all in our legislation in review report, which we publish shortly after the session ends every year. Ellie and the legislative team are hard at work on it now. If you join our mailing list, we'll let you know when it's out. If you're not on that list, to get on it, just go to our website, coloradohealthinstitute.org, scroll down to the subscribe button. So with that, we still have plenty of time, I think, for questions. Just type your question in the Q&A box at the bottom of your screen. Who has our first?
Hi, Joe. I think our first question is from Lynn Jones. So Lynn, thank you for jumping in early with a question. Lynn's question is, any indication as to what will happen to all these things that have been funded when the response dollars are no longer available? My understanding is that they will only be available as short-term funds. Great question and point, Lynn. And Joe touched on this a bit, I think, when he talked about the dollars and their uses in his section. But let's talk about it a little more. I mean, this has definitely been a consideration for legislators as they think about how they want to spend the funds and what is like the best and most responsible use of the funds. You don't want to maybe start a bunch of new programs that don't have sustainable guaranteed funding. This is really a one-time infusion. That's made some things like capital construction really appealing, right? Paying for a new building or fixes to a building, or short-term projects or programs. Colorado, I'll mention, was also able, I think, to use a pretty big chunk of our funds to do things like bolster our state reserve, which we had to drain down pretty significantly last year in an attempt to avoid some more severe budget cuts to programs, and also to pay down the negative factor, which is that basically funding gap that just accumulates for education in the state. So those were kind of some like short-term things on the wish list that legislators often don't have funding for. And then finally, I would just mention that the clarification we got, we as a state and a country, that the funds, as long as they are directed by the end of 2024, can be used for things that go through 2026, just created a little more breathing room, right? That's an extra 2 years. And so maybe if you are starting to think about a program, knowing that this could be used to fund it through 2026 gives you a little more time to figure out a plan or identify a sustainable source of funding. But with that said, I just don't know enough, and I'm not sure they've made enough decisions about where all those dollars are going to see how they've answered that question, right? Do they feel comfortable starting a bunch of new programs rather than short-term or one-time uses of funds? And Joe, I'm not sure if there's anything that you want to add to that.
Yeah, I would, and it's a great segue into the next question too, that these are short-term funds, but maybe we need to think in a bit of a different time horizon, that it's really, this money is going to be with us for the next several legislative sessions. This is not just a one and done and we go back to the way it was last year, that there's the opportunity here is, it expires, but it expires in 5 years, and that's a decent time frame. Aubrey Hill asked a question that I promise I did not plant, but she says, will CHI be tracking the stimulus spending in a detailed way online? I'm curious how counties and cities are spending, for example. Answer is yes, we are trying really hard. It's just a huge project to get our arms around. Chiefly because a lot of the spending decisions have not been made yet. Like you saw with the legislature, there's only really far less than 20% has been appropriated to a specific purpose. So what we're trying to do, first of all, is just figure out the different buckets that this is coming in. We talked about the $3.8 billion that the state got, but as Aubrey mentions, there's another nearly $2 billion for cities and counties. And then apart from that, there are these other separate funding streams as well. We are attempting to track, as far as we can reckon, $10 billion that is going to different state agencies or local agencies or regional public agencies, basically, that are that's apart from the PPP loans, the $1,400 checks that we got last year, unemployment benefits. This is like public spending. We think it was going to come close to totaling $10 billion. So we're working hard on that right now, and we aim to kind of release it in pieces as we get one class of questions answered. We'll put that out, and then we'll dive deeper into the details.
What? All right, Joe, I think, oh, go ahead.
No, go ahead, Ellie.
Sorry, we never can quite plan our Q&A. It just kind of happens. It's good to have some spontaneity in our lives. So we have a couple questions from Megan Wilson that came in the chat. So thanks, Megan. The first one is one that I will just say up front, I don't really know the answer to. It's how will the transportation funding impact rural communities from an access to healthcare perspective? Really interesting, Megan. Joe, I don't know if you have thoughts on that, but I think I'm not familiar enough with the bill and if there are either funding or other provisions, or if it's just as simple as like having better roads and transportation infrastructure is helpful in a state that is really large geographically, where a lot of people have to drive a really long way to a hospital or to get healthcare services. What would you add?
Yeah, I would say that Colorado's process for allocating transportation funding goes through the Transportation Commission. And that is, there's a public process there to engage, to advocate for specific projects. And also there are rules that have to, that make sure, or attempt to make sure, that rural areas of the state don't get shorted when it comes to highways. They're just like a whole lot more miles of blacktop per person in rural Colorado than in or on state highways, at least, than in the metro area. So that's specifics, I think, are that's really that should be handled at the Department of Transportation Commission. But certainly it's not just highways either. There's been a lot more interest in rural transit as well, and some communities that are doing it pretty well already.
Great. Another question we got from Megan in the chat, Joe, is what role does CHI plan to play in ensuring health as a part of the new Department of Early Childhood? Great question, Megan. We are thinking through that. We would love to be part of it and think about how to make sure that health policy and wellness considerations are a big part of that. We've done more and more work in the early childhood space in recent years and worked really closely with the Office of Early Childhood. And so that's another question I don't know the answer to yet, but it's certainly something we're thinking about and watching closely, and really excited to see how that new department shapes up. Joe, anything to add?
Yeah, we want to, we and I know everyone in the health space really wants to share our thoughts in this. It is very new. This is a bill that came about in the last part of the legislative session and went through pretty quickly. So we're working to get in contact with the state's leaders in this area, and luckily Colorado has a really good foundation community and a lot of outside the government expertise that I'm sure will be a part of helping supply that.
Great. All right, I think we just have one more question so far, and we may have time for another if anybody out there has something they'd like to chime in with. But want to address Rick Kurtzinger's question. Hi, Rick and QHN. Rick asks, thoughts on the urban-rural divide and whether this session helped bridge the divide or made it wider? Joe, do you want to take the first crack at that? I realize I've been starting to answer all of these first.
Yeah, thanks, Allie. And I used to be a reporter for the Durango Herald, so I'm quite familiar with political geographic split here. I don't know about, I don't know if the urban-rural divide is getting any better. It also seems like our national politics are driving a lot of this at the moment. You saw rural counties around the country and in Colorado be much more likely to increase their votes for former President Trump. Well, urban counties went the other way. I will say that there are really we really see two rural Colorados, and the split between those is getting a little bit different as well. There are the mountain recreation counties that have gone blue and are look to stay that way. And then there is the mining, oil, gas, ag counties that are becoming more conservative. It's it's a problem, and we're seeing it in vaccination rates actually, where I've been playing around with vaccination data and layering it on election results. And it's a fairly strong predictor of how many people in a county are vaccinated based on what happened in the presidential election last year. That's a problem that we've got to address. And it's not just the legislature, it's those of us in public health and just Coloradans in general. I wish I had a better answer for you, but that's how I see it.
And Joe, I maybe would just mention, agree to everything you just said, that I do think we often see some of the rural legislators working pretty closely together across the aisle on legislation, particularly those on the western slope. So, I think about legislators like Dylan Roberts, Carrie Donovan, maybe Barbara McLaughlin from, mountain areas, I-70 corridor, Durango, frequently working with Perry Will or Janice Rich or Matt Soper or Bob Rankin. These are all Western Slope Republicans. And I think that they often will team up on things that benefit non-metro areas and particularly, that part of the state. And so I think there's always been a pretty strong opportunity for some bipartisan cooperation there among a subset of legislators. And I think that continued this year on a variety of policies. So that's certainly something to keep looking for.
Yeah, I'd agree, Ellie. There are two big issues I see that are where the policy is stronger than the party bonds. And that has in the past been healthcare costs, which have been a lot worse on the Western Slope, and water. And if you're a water watcher and seeing the big reservoirs downstream on the Colorado River, Lake Powell, Lake Mead dropping, that there's a reckoning coming for water. And that will be, when that day comes, it's not going to matter who's a Republican, who's a Democrat. That will really bind at least Western Slope legislators together, I think. Do we have any more questions, or maybe we should let everybody go for 3 minutes early so you can fill your coffee before your 9 o'clock meeting or your day gets started?
Yeah, I think we're good. No questions, and we'd love to give you 2 or 3 minutes of your morning back.
All right. This has been recorded. We'll post the video on our website, colo.health/eggheads, and we'll have that up this afternoon, I hope. So thank you so much for joining us this morning. See you next month.
Thanks, everyone. Bye.